So hi, my name is Osama Maher. I am a pediatric neuro-oncologist at Nicholas Children's Hospital. I have been practicing brain tumor since 2017, and through my practice I have seen many cases of brain tumor, and one of them is called the IPG, or diffuse midline glioma. Just to explain what is that exactly, it is actually a tumor that originate or start in a very deep midline structure of the brain, area called the brain stem, and the area surrounding. And this tumor, we know that it grow in a very short period of time and makes the child very sick in a very short period, which means that the child might be running happy over like a week or so. He start to have like droopy eyes, the face is not symmetrical, so he has some vomiting, and the parents rush to the emergency and they get the bad news that he has a tumor which is incurable or which has no cure, and radiation only help to temporize or make things, good for a few months. The tumor is afterwards there is no cure. So when I look at the IPG first, the IPG, we call it the IPG because it grows from area called the pons, and the pons actually control our breathing, our heart rate, our blood pressure, our movement. And this tumor, we know that once it grow, there is no treatment for that. For many years, we didn't have any information about this tumor, so we just do radiation, and we tell the family, we are sorry, there's nothing else to offer, and everything else has failed. Then recently, here in the United States, in Europe, we start to biopsy these lesions and start to understand about the molecular analysis, the mutation of the tumor, and this helps us actually to develop different clinical trial now, like with something called vaccine therapy, immune therapy, targeted therapy, to help actually to find cure and find hope for the kids and for the family whose kids suffering from this tumor. And there's also another tumor which is very close to actually the IPG called diffuse midline glioma, which is the same tumor, same biology, same histology, but arise from the area around the pons or around the brainstem, which is actually have the same treatment as well, and unfortunately same outcome, which is the kids, we know that the kids die from this disease. By 1 year, maybe like I would say 80% of the kids die from this tumor, and by 2 years, almost all of them, they die. Unfortunately, we as physicians, our hope that we find cure for this tumor, because I would say it's the only pediatric tumor now that there is no cure to date. All other tumors, there is some hope to cure, except actually the IPG or diffuse midline glioma. So I really encourage clinical trials. I encourage more scientific knowledge about this tumor, more learning, in order to try to help these kids to find cure from this tumor and embrace happiness to the family and the children. Thank you.